We'll start in just a minute. Welcome. I know we have people continuing to join us. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I have 3 other people joining me today to help kind of walk through the process of applying for 5-star certification here in Boulder County, which is available starting today. And then we will spend as much time as we need, well, not as much time as we need, but up until noon today to answer questions about 5-star. So joining me on this call today, I have Lane Drager with Boulder County Public Health, which people know from the public health calls if you're on those. I have Jessica Erickson with Longmont Economic Development Partnership. She has been a great partner of mine in helping to launch this program here in Boulder County. And also, you'll notice that when you do the 5-star program, the payment processing will be happening through the Longmont Economic Development Partnership. And then last but not least, I have Heidi Hofstadter with H2 Manufacturing Solutions, who's our third party vendor who's helping us implement this program here in Boulder County. It is the same vendor that Denver is using. So those of you that have applied in Denver and gone through the process in Denver, we are using the same process here in Boulder County, just different websites, different admin committee, but same vendor. So what I'm going to do any of you want to share anything before I get started? Okay. So what I'm going to do is kind of walk everybody through the website, the pieces that are available, and kind of the materials you're going to need. And then we will take time for questions. And as I'm doing that, I also have people requesting the Zoom link for today's meeting. So I will also try to cover that. So what I'm going to share right now is the Boulder County 5-star website. This is the landing page for Boulder County. It is bit.ly/BOCO 5-star or boulderchamber.com/BOCO 5-star. You'll notice that on this page there is a toggle to allow us to go between English and Spanish. Virtually everything is translated into Spanish. So if you need signage, the applications, the response emails, all of that is available in Spanish. As of 1:30 today, if you were not on the list of people that pre-registered or gave us your interest, we will put live the link for the application on this site. Right now it is not live. Those people that submitted the pre-interest form did receive the links this morning so that we could phase open the applications, and we've gotten quite a few already today. We will also put a recording of today's video on here. Please note that on this website are things like an information video on how this process will work in both English and Spanish, the EPA and cleaning supplies video, because in your application, and Heidi can go through this, you will be required to actually submit some of your cleaning supplies lists and make sure they're EPA certified. Your HVAC checklist, this is very important. I'm going to show this to you in just a minute. The HVAC checklist needs to be filled out prior to the application. This is a self-certification that you will submit with your application. And there is also a link in the application, but it's probably better that you take it from the emails or this website and you actually fill it out. You fill it out beforehand. The actual application is in here as well. It's in PDF. This is not the one you're going to submit, but this allows you to see the questions that will be in the application if you didn't get the email this morning. And then the pre-inspection checklist. We'll also get this once you apply, but we've had it live since Tuesday, so you can start preparing for this information. Also on this website, so once the application's live, it'll be up here at 1:30 today. We'll have 2 different types of applications. We will have a single entity application. You are one licensed facility under the roof that you want certified. Then we will have a multiple license facility application. And this is for those sites that have multiple licenses under one roof that would like to be 5-star certified. So, for example, a hotel that has an event space, so the hotel event space, and then a licensed restaurant. You will apply under the multiple facility application. So, whereas you're still applying as the separate entities, you're going to have one inspector. This allows H2 to send out one inspector to the site. I see there are questions already coming in, so we'll get to those. The volunteer recruitment side, the volunteer recruitment is very important. The more volunteers we have, the smoother this will go. Volunteers can take two roles. They can be trainer. We train you, H2 trains you to be an inspector. You're a volunteer inspector going out into the community and inspecting businesses. This is a way to help us increase the number of inspectors we have, keep the costs down, and allow us to get as many businesses inspected as quickly as possible. We've had quite a few sign up in the last couple of days. We had a good batch go through on training on Wednesday. We have another training this coming Wednesday. So if you know anybody that would like to be an inspector, please sign up prior to Wednesday so we can get you into that training. I did it. I got 17 out of 17 on my test, so I'm ready to go out and inspect in my free time. You'll see that the responsibilities are listed here, as well as a link. There's also a link to be able to sign up. And last, I'm going to mention on the website are the resource donations. So we do have businesses in our county that cannot afford the application fee of $100. And I'll explain the process on that in just a minute. If you are able to provide either additional funds for another person's application fee or additional funds because you've been able to stay open this whole time, there is an opportunity to give back money. We've already had some great and very generous donations from businesses throughout our community. So we appreciate that to help support businesses that are not able to afford this. I'm gonna see what the questions are. So the website, so I'll share the website. We'll get to the questions in just a minute. So let's go to the checklist. So first is the HVAC checklist. And Heidi, could you explain this? Because there's been some confusion around this part that says this section is not a requirement for the state, but they still have to fill this out, correct? Can you explain the HVAC checklist?
Sure, and Lane might have to jump in too, because this is pretty much the sole discretion of public health. So in the 5-star, one of the requirements was that you had to increase your ventilation. So the thought process was, if you could answer the questions about your HVAC system above that bold line, great, please do. And if you you couldn't get a hold of your HVAC specialist or your landlord, the requirement from 5-star and blessed by Boulder Public Health was that you let them know below the line which things you have done to increase ventilation in your building. I could go down that rabbit hole and explain why it was divided up that way if you want. Otherwise, I'll stop there.
No, but the idea, the top part where it says not a requirement per state guideline is just, this is to give us information about the HVAC, and it is a self-certification. You know, a lot of we've talked to some HVAC companies that said if you've had a maintenance within the last year, if you call with your receipt, a lot of the information you need is on the receipt, or if you call, they can probably answer most of the questions that are on here. So that's the HVAC. That's the HVAC checklist. You, like I said, Heidi, you have to turn this in. What happens if you don't turn it in with your application?
It's a requirement of the application. You just simply will not move through the channel. You won't be able to move past that part of the application.
Great. So then this is also available. You will get this. This is the inspection items. These are the inspection items that the inspectors will be looking at. Some of these are not applicable if you do not have an elevator. It is listed as not applicable. It doesn't mean that you won't get dinged because you don't have an elevator. A not applicable on the inspection is not a ding. There are videos available for all of this, but I just wanted to point out that piece. There also on the website, you'll notice, please watch this informational video. It really does walk you through the process. Once you do submit your application, you will get responses, you'll get emails, you'll get sent. You can submit your application without payment. So you submit your application. As soon as you submit your application, you'll be directed in an email to pay, to a link to pay on the Longmont Economic Development Partnership site. You can pay by credit card, you can pay by, get invoice and pay by check, or you can submit for a hardship grant. So please note that. Also, so we have the pre-inspection checklist. Sorry, I'm just gonna go through. Also linked on that website are every sign you're going to need. So we have both Spanish and English. We have signs about closed seating. We must collect contacts. We must symptom check. Please wear a mask when you're not eating and drinking. Do not enter without a mask. If you need to file a complaint against 5-star, there's that poster in here. All of the masks, we have that mask toolkit for you, or I'm sorry, we have the sign toolkit for you in English and Spanish. So please take advantage of those signs. If an inspector comes out and you're missing a sign, you're not going to leave and then come back. You can go print that sign out. That is part of the inspection process, is allowing you that opportunity to, if it can be fixed within 15 minutes, fixing the item. I just want to point out 2 more things on the state website. If you are, once you are 5-star certified, on the state website, you'll notice there's a map where it shows the county status. Right now, our county is in level orange. Please note there is a press conference with the governor about the dial changes, most likely happening today. So any communication around that and how this will affect 5-star will be sent out to you. But if you toggle over Boulder County, you'll notice it says we're in level orange, but our 5-star status is level yellow. So if you're 5-star certified, then you are able to operate in yellow. And this is a good place to keep updated on what level you can operate in 5-star. If you are located in multiple counties, I know this is a question that has come in. If you're located in multiple counties, you are going to have to apply for each county. So Heidi, luckily you're operating in Denver, so it's pretty similar process, but you're going to have to apply in Denver. You're going to have to apply in Jeffco. You're going to have to apply in Larimer. And because this program is county specific, the counties had to build the program. It may look differently in each county. Denver, luckily, and Boulder are pretty similar. Lastly, I'm going to show you the application. This is what the application is going to look like. If you didn't get the link this morning, this is what it's going to look like when it goes live. There's an English and Spanish version. It reminds you, please, before you start, you have access to that HVAC checklist. You'll go through, and all the questions have been released since Tuesday as far as what the questions are. It's a pretty simple application, except the fact that you have to upload that HVAC checklist into it. The multi-tenant one will look a little different. It'll say Boulder 5-star multi-tenant intake form. This is going to be a different link, and this will be that application. Once you go through and you do your application, Heidi, what happens next? What happens after they submit their application?
Sure. After you submit your application, you'll get a confirmation that's really specific about all the steps. One of the steps within the business confirmation that you'll get emailed. So let me stick a pin in that for a second. Check your spams, please. You should get it within 5 minutes of entering your app. Okay. So if you don't, check there. But there is a list in there that you'll have access to get you ready, which Corinne showed you earlier. Once you're ready, you feel like you're ready for the audit. We ask you to fill out an inspection ready form. And that'll basically trigger us to say, yep, you're ready to go. And we send somebody in.
And I put that form up. So you'll fill out this inspection ready form. There's big bold letters here, do not submit this form until you're ready for an inspection, because we do have inspectors that are trained and ready to go out, and they will be assigned and they will be scheduled. And if you're not ready and we have to cancel the inspectors and we have to go back and forth with them, we're afraid we're going to lose some of the volunteers that have graciously given us their time to do this program. So we ask that you really look at that checklist and make sure that you're ready for an inspection within 48 hours of receipt. And I put on the screen the inspection ready form. Please, please, please. This was a lesson learned in some of the other counties, that we need you to be ready. So don't just fill it out because you want to fill it out because you want to get into the queue. Fill it out because you're ready, because there's a good chance we'll get you scheduled early next. Try to start getting you scheduled as soon as your application's ready to go. So that is the last piece I wanted to mention on that, is that inspection ready form is very important. Now, Heidi, can you talk a little bit about the inspection? What happens at the inspection? I'm going to turn off the share. Talk a little bit about the inspection, what to expect after the inspection. So the inspector comes in, they look at the checklist, maybe walk through that a little bit, but what should they expect afterwards as far as certification?
Sure. So the inspectors are going to come in. They're going to, if you've already gone through the pre-checklist, it should be smooth sailing for most everybody, because we're trying to take some of the legwork out up front. The inspector is not really going to engage with you on, things like, where are we at on the dial? How did I do? Because they're just there to process that data for us. Following that, we have 2 business days, I believe it was, that we communicated to get back in touch with you. And you'll get one of 2 things from us at H2, of course, approved by everybody on this call. You'll either get about a 4-page report, very easy to read, to show that you either passed and had no infractions, you're good to go, and you'll get an electronic certification attached to that, until such time, I think that Corinne, she'll fill you in on the parts after me. Or if you had some infractions, which we, for the most part, have been seeing very minor ones in Denver, you'll get a very concise action plan to say, here's exactly what you need to do. It's really spelled out. So we try to take any of the guesswork out for you. Once that's done, you would let us know you were once again ready. You would fill out the audit or the inspection ready form again for us. And then we would send somebody out. Does that answer your questions there, Corinne?
Yep. And I think a question has come in is, will we know when the inspection's happening? And the answer to that is yes. So you will, when you do the inspection ready, you will designate times that you're available. We will match that with an inspector who's available during that time, and you'll both get a confirmation that both have to reply to for that. So you will know when your inspection's happening. It's not a surprise inspection. Nobody wants to be surprised in this process. So please know that it won't be surprised. And that way you can have your manager, owner, or whoever present that you would like present during that time. All right, so we had some questions that asked about putting the link we put the link into the chat. So we put that link into the chat for the homepage. Please note that the application is not live on there. If you, that will be available at 1:30 today. Let's look at some of the other questions. So the question about, do we have to post every sign that's in the Google Drive? The answer to that is no. You have to post the signs that are required in the checklist. Those signs in the Google Drive have been available in Boulder County since the beginning of all of this. So use whatever signs you would like. There's still some red, we're operating in red. We're at 10% capacity signs in there. You have to post things like, there are certain requirements and signage required in the checklist. So we tried to provide as many of those signs as you possibly could need. These chairs are not for use. Please put on a mask if you're not eating and drinking, We got requests for signs that say, because of 5-star, we have to symptom check. So we put those signs in because I already got requests for those. So the answer to that is just go through and see if there's the signage you need. If not, we also have links to CDC signs that H2 is also sent out, and we have both the English and Spanish for those too. So a question, that's it. Okay, so there's a question about, I'm gonna get into some of these specific questions. So let's talk a little bit about restaurants. The space in between tables, the 6 feet, 10 feet confusion. The 10 feet is only if we're in red. Spacing that will be inspected upon is 6 feet. Lane and Heidi, you guys correct me if I get anything wrong on these, but it's 6 feet. So that 10 feet, we know a bunch of people were afraid of this program because they saw the 10 feet. That's if we were operating in red. We are in orange, so you will be inspected on 6 feet. The inspectors have tape measures, they may look at, and that's for the indoor. They're going to be inspecting your indoor dining areas.
I would just clarify, it's 6 feet between adjacent table patrons. So not necessarily table to table, but where the people will be sitting, at adjacent tables need to be 6 feet away. So once the people are in those seats, you can't have a table 6 feet apart, then 2 chairs that now the people are like 2 or 3 feet apart.
Okay. So Lane, could you answer, is bar seating allowed?
Bar seating is allowed if that area of the bar is designated for seating only and the spaces are, adequately spaced and there's no bar service happening in that area of the bar. So typically that would be a very large bar. One section is allowed for seating, but the bartender is not back behind the bar making drinks in that area. They would need to be at least 6 feet away from that seating area.
Okay. Where can we find list of exact signs we must post? Go through the checklist. The checklist will say, have a signage at entrance about symptom check. Have a signage at entrance about, about collecting information or sanitation or wearing mask. If you go through the checklist, it says in there, the pre-audit checklist, it will tell you which signage you need to have. Also, go through your order. Through the orders for your specific industry and make sure you have all the signage that are in the orders that have been around since April. So if you're, if you need to have a mask sign because it's required by the state to have a mask sign, that should also be there, be in there. So Heidi, what are some common infractions that you're seeing in Denver that they should avoid?
No, it's usually, I just have to say, it's usually the simple stuff. It's usually, okay, your tables are 5 feet apart instead of 6. You're missing a couple of signs. Yes, it's true. You must be masked at all times when indoors, unless you're of course eating at the moment, but like it's simple things like that are, it could be in a restroom, for example. Maybe there's not a sign about the mask and the hand washing or things like this. We haven't stumbled against really major trials and tribulations, to be honest.
So, and the point of the inspection is not for the inspector to go in and say, oh, you're missing that sign, I'm going to put note and we're going to come back later. If you're missing that sign, that's why we have the toolkit.
Yeah.
They might say, let's go print it. Go print a hand washing sign because the bathrooms need a hand washing sign or social distancing sign in your break room. Go print that. We know you have a toolkit for that. Let's get that up and that way we can check it off.
Totally. And the other thing, you just hit on it, that's a big deal. And this is kind of across the board. Social distancing is for your employees too, even if you're hanging out chatting. So know that it's not just about your patrons.
Okay, we have a bunch of questions that came in. So if you pre-registered and didn't get the link, Julie, I'll make sure I send that to you and for the application. Let me see if it went into your spam, but it was linked to in the email if you got my email this morning. Would a rec center need to submit 2 licenses since they're 2 different DAO requirements, one for the fitness and one for sports recreation? Lane, have we?
I don't think so. Again, it's facility based. So how that facility is going to be used, there may be multiple sort of sectors that are using it, but when the audit is done, they're going to be looking at how that space is set up to address all the different factors in the checklist. So that I don't think would be a case. If there were multiple uses in the building beyond just a gym, then there was, say, like a salon or some kind of personal services, that potentially would need multiple inspections. But the gym that's sometimes being used by general people and sometimes being used by sports clubs, all should be audited as a gym.
Because it's about the facility, and that facility has that license as the facility. Yeah. So if they're a hotel and they have a restaurant and event space, but they don't actually have a separate license for their restaurant, how are we managing those? Heidi, you're on
Sure.
mute.
Sorry about that. Yeah, we have a multi-tenant. Oh, I'm still muted? Oh,
No,
no.
you're fine.
Okay. We have a multi-tenant application. You'll still comply with the industry sector that is involved, but what we're trying to do is make it a more efficient process. So we'll send one auditor into you, which is why you would be asked to fill out the multi-tenant. And there's been some confusion on that. So if you think of Big RF, for example, you have multiple locations, so that would not count. It's all within the same bricks and mortar. So we would encourage you to send that in. And we'll make sure that one auditor gets out to you to do all of those services inside your building.
So in most cases, if you have multiple, like we're having to look at indoor event space as well as and restaurant, I would still do the multiple facility even if you have one license. Hotels, in most cases, you're going to be doing the multi because of the restaurants. Your gyms are not, because your gyms are your private gyms for your facility and your hotel. It's about your event space, which has different inspection criteria than the restaurants. So let's have you still do the multi-tenant, multi business application.
And as public health, we license the restaurant and the retail food establishment. We don't license event spaces. So that you may only have one, at least public health license. And that's just how our regulations are set up, that event spaces are not regulated normally outside of the COVID world by public health. Just the food service part.
What about if we have 2 businesses within the same building, but they're operating under the same business and liquor licenses? Do they need to, are they 2 applications or are they lumped under one?
I can share what I've been doing in Denver. I don't know if that aligns with Boulder County, but we've been doing the 2 separate facilities.
The 2 different, because we actually have to submit to the state each. So even though you have your 2 different businesses, even though we're having to submit the businesses, but they're operating under the same business and the same liquor license. They just are 2 different businesses in the same. This one we might have to have you email me your specific example, but we have to actually submit each business. So if you're wanting to certify both businesses, we have to submit each business to the state separately, which is what makes this so confusing, is that we need to be able to identify each business separately. Okay, what if the business is split between 2 buildings just across the parking lot from each other, but it's the same business? Heidi, is that going to impact anything on the inspector? Nope, no impact. One application, same business. You just have 2 different buildings. Would you have to submit 2 HVAC forms if it's 2 different HVAC systems?
Yep.
Okay,
Sure
so you're
would.
going to
We haven't run into that yet, so that's a new one.
Yeah. Thank you, everybody. We're going to keep. Okay, we got that question. Do all staff need to be trained on how to disinfect break room appliances if they're cleaned daily by the janitorial team? Heidi, we're gonna have a lot of questions for you today.
Can you say that one over for me, Corinne?
Do all staff need to be trained on how to disinfect break room appliances and how to disinfect items if it's cleaned daily by a janitorial team? Because on the checklist, it does say everybody needs to be trained on how to do it, correct?
Correct, yeah. And you need to make sure that your cleaning supplies are EPA certified, which we also include in the prep work.
And the way that it works is the inspector comes in and they ask, is everybody trained on proper cleaning procedures? And so while they may not be doing the cleaning, is everybody trained on how to clean up if necessary or clean in a COVID world?
Yep, with the right supplies.
The right supplies. Oof. We knew we'd have a lot of questions. Do customers entering the restaurant to use the restroom have to be temperature checked even if they're seated outside? So the procedure is when anybody checks in, even if no matter where they're seated, you need to do a symptom check on the individuals checking in, and then you need to know where they're going to be seated. You need to have a contact person for each party, whether they're seated indoors or outdoors. You need to know which table they're seated at. So those parties will be checking in. That procedure will be the same whether they're seated indoors or outdoors. And then when they're seated outdoors, there's just some nuances on that, but the procedure stays the same. Correct, guys?
Yeah, I agree.
Okay. So
Contact tracing.
Contact tracing. What's the minimum what needs to be done in the contact tracing? It's the temperature, and then asking whether they've been exposed and if they have any symptoms, correct?
The screening, you mean, versus contact tracing?
Yeah, sorry, screening, symptom screening.
Yep.
So you need to make sure they don't have a temperature of above 100.3. And then they're asked if they've been exposed to anybody with COVID and if they have any of the symptoms that are on the symptom checklist. Okay. I got this question before, so if an employee decides to stay and let's say have a beer after work, do they have to be re-symptom screened, or is it okay that they were symptom screened when they came in as an employee? So they've entered the facility where you have the symptom screening of the employee. You don't need to re-symptom screen them as a customer because you already have their note for the day, but you're going to need to make note of where they sit, correct? Because that's going to be that contact tracing piece, correct? And I don't know if they can see you guys shaking your head. So yes, I got a yes from Lane and I got a yes from Heidi. Lane, this one's for you. Are pool tables allowed to be operational with proper sanitation? And Heidi, you might be able to answer on this with the inspections.
This, I think, will be something that may be addressed in the public health order and the announcements that the state is going to be making either today or next week.
Regarding the entry form requirements, can we just have a sign that people entering the building acknowledge they don't have any symptoms and don't hold a temperature, or do we actually have to ask each patron and take their temperature?
Yeah, people need to be screened. They can't just have a sign telling them not to come in if they have symptoms.
Yeah. You can have a sign that says don't come in if you don't have symptoms. If you're sick, please don't enter. But every person entering a facility must be symptom screened. Are there special dining hours required for people at higher risk? I'm not sure who can answer this one. I don't believe so in the checklist.
No. I know in the general business, you need to accommodate those folks or try to, but I don't think that's outlined in restaurants, is it, Lane?
I'm getting a bad connection, so that broke up a little bit. But I think in general, we do encourage people to have hours for vulnerable populations, depending on, again, what business sector, but it's not spelled out as a requirement.
How many people could be at each table for indoor seating, Lane?
It's a restaurant.
Yep.
It's 2 households, and I think right now it's 10.
10. And Boulder County is also limiting to 10 outside, correct?
Yeah, I'm gonna pull that.
Interpreted it. Okay, so there is, so a little bit more about the minimum HVAC requirements. The minimum requirement is that they have to have increased their air circulation by 3 of those items on the checklist. That is on the checklist. That's the second part of the checklist. Heidi, do we want to go through some of those items that can be done to increase air circulation?
Yeah, sure. Do you want to bring it up, Corinne, or do you want me to just kind of go off memory? What's easiest for you?
I can bring it up again. We're getting a couple more questions about it. Let me just bring it back up.
They're pretty easy accommodations. If weather permitting, we'd ask that you try to open, windows and doors at opposite ends of the building. Make sure your vents are unblocked. Yeah. Again, they're not overwhelming. As you can see, vents and exhaust are unblocked. Make sure that your bathrooms and kitchen fans are working. Some of these are, if you have air purifiers, great. Most people won't. If you can, and if you have access to your HVAC system, there are a couple things you can do to increase your outdoor air exchange inside the building. But as you'll see, and then you can note if there's something above and beyond that you've done. Elaine, am I forgetting anything? I mean, there's the obvious, which if you have, a high grade filter, please use it. If you haven't maintained your HVAC, please do so. Those kinds of things could also fall under other.
Yeah. And one of those, in the MERV filters, we put in here that those are the highest rated. Those are the ones that people are recommending. That's above here, but you could put that into the other because you've increased your safety precautions.
Yeah.
So, but the idea is, and
I think we try to make it pretty achievable and safe.
Okay. So Heidi, the square footage that's asked for on the sample application, is that asking for the square footage for indoor area only?
Oops. I hate that mute button. Yes.
Okay.
I did post all the guidance for restaurants, so folks can look through all those requirements, but it is maximum of 10 in the groupings, both indoor and outdoor for restaurant seating.
Okay. I'm going to, for those of you on the call, apparently there's a couple that believe they were pre-registered but did not get the link this morning. I will send it to you as soon as we're done. Just note that it will go live as well at 1:30 today. So let's answer that one. We'll answer this one. Okay, so the complaint process, and this, we have an Erie business on here, and I want to say congratulations, Weld County Erie businesses. I'm so glad we could get the town of Erie, both sides, in under this program as it goes. The question is, if they file a complaint, should it go to Boulder County? Actually, the complaint comes to the admin committee. So on the website, you'll notice there's a complaint process, and even the posters you put up send people to that landing page. The complaint doesn't actually go to public health. It goes to the admin committee, and it goes to Colorado Department of Public Health and Environment. then I get it. And we have an admin committee group of 5 or 6 people that will then look at the complaints, verify them, and rate them based on low priority, high priority, as to whether or not we need to resend out an inspector. We'll send out a email or letter having to do with the complaints. And then there are action steps. We'll try to be as transparent as we can. If it is a major public health infraction, and it is verified as such, it may then be referred to public health at that point. And at that point, if you're on the Weld County side, it would probably go to Weld County Public Health, because it's then being elevated to public health. But all 5-star certification complaints are actually not handled through the public health system. They're handled through the admin committee of 5-star. Lane Drager from Boulder County Public Health does sit on that committee, and is helping advise it and helping so that we coordinate. But that's just to clarify those. That's why all the posters direct people back to the landing page for 5-star. Just a particular thing. Do you want to add anything to that, Lane?
No. We would do referrals back and forth for things. If those inadvertently come to public health, we will direct them to the 5-star committee. And then obviously things that need to be investigated by public health will get referred to us.
So Heidi, there's a question about if it's common use area in the office, like the elevator and the stairs and the drinking fountains that are not in their actual office area, is that going to be something that they're responsible for on the checklist and inspection?
So when it comes to, and this has come up a lot, if you are sharing an elevator like in your building and you're exposed to it, your employees are exposed to it, the expectation is you would have some sort of hand at ensuring that elevator is maintained, or that there's access to, for example, I'll utilize Jessica Erickson as an example. They have an elevator in their building, and what they've done is make sure that there's sanitation wipes by the keypad, right? So little things like that you can do. Anything that's high touch surface that your community is exposed to, you're going to want to play a part in that. And Lane, if I have that wrong, please advise.
And I know it's a challenge, but it would make sense to work with the building owners and maintenance to ensure that these steps are happening. A lot of the pieces of the 5-star program, I think, should be happening anyway. So it's not that every item on the checklist is an above and beyond. There are some components that are, but a lot of the things should be happening already. And I know that is a challenge when there's multiple tenants, owners, and sometimes they aren't really present at the site.
Okay. Just keeping track of all the people that didn't receive my email this morning. Okay, so they have 2 restaurants in the same brick and mortar on the same liquor license, but only one restaurant is applying for the 5-star, but they have some common areas. They just need to do one application for the one restaurant that is applying for 5-star, not the multiple applications. But you're going to need to look at those. If we're looking at the offices and the employee areas and storage, we're going to be looking at those other areas within the checklist as well. Even though they're shared by the other restaurant that's not applying, those are the break rooms, those are the offices for the restaurant that is applying. So
if there's a shared bathroom, all of that. I mean, any of the spaces that are being used by whoever's being certified is going to be inspected.
Yeah. Another example of a hotel has a spa, so personal services. So if a hotel has a spa, a restaurant, and the hotel, then yes, the spa would be you want to use the multi-tenant form for sure in that case. Does 5-star allow for variance for events or event venues like live music and parties? I'm not sure if Lane, if you want to answer that one.
I'm not sure if I fully get the question, but 5-star I guess, is allowing a business that's certified to operate one level above where we currently are on the dial. It doesn't give any additional variances beyond that. So, so it is in itself a variance, I guess, to operate at a different level of the dial, but it doesn't give any other variances beyond that.
Right. Symptom screenings. I have a bunch of questions about symptom screenings. Do the symptom screenings need to be logged and saved? And the answer is yes. Can a person fill out a Google form? Is that sufficient to doing the temperature and symptom screening? They can do a temperature and fill out a form. The answer is yes on that one.
In fact, Corinne, if people have an issue with that, we have a standard link we can send them at H2 for screening and they can log it.
Okay. All right. So Heidi, on the event spaces, I think there's a lot of confusion, and the person asking this question is trying to help clarify the confusion. For indoor event spaces, they don't need to actually submit their floor plans and seating configuration charts with their application, correct? Or do they?
No, so really at the end of the day, what this boils down to for us, and again, what we've done in Denver, I believe there's an online calculator with CDPHE for square footage. When you're in the red, it's 144. Every other level, I think it's 72 square feet.
So if you're seated, it's 72 square feet. If you're walking around, it's 144, something like that.
So you can calculate it out actually based on what you know of your facility, and it's a capacity issue, right?
So what you're inspecting are the operations, the facility, making sure they have the pieces in place to be able to operate the events. You're not going to be asking for their seating charts and how they're keeping with their capacities. That's all part of the order. That's what they should be following under the order anyways.
Yeah, a lot of that's already set.
And it's a little challenging when they have an event space that they're using for some kind of seated dinner service. They're going to be following the restaurant requirements. So again, the table spacing so that the patrons are at least 6 feet, no more than 10 people per table. So it kicks in more as a restaurant requirement if that's how that event space is being used. So those are some of the challenges versus it's being used for some other function where it's an indoor event where people are going to be moving around. Now you're again looking at the space calculators to figure out what the occupancy can be.
So on the HVAC form, if they're already doing all of the items on the ventilation, the question is, how can I improve 3 things? They don't really need to improve. They just need to be doing 3 of the items on those on the ventilation piece, right? They don't need to improve what they're already doing. If they're already creating cross air between 2 sides of the building, they've already done this. Those are the improvements we're asking for, correct? So they can check off all of them then and submit their HVAC form, correct?
Yes.
So then, Lane, can you go through the requirements on performers and how far away they need to be from patrons, specifically that 25, and what other pieces for that?
25 feet. I don't know if I'm getting bad connection, but yeah, 25 feet from the performer to the patrons. And it doesn't matter if the performers are masked or not. There is not an exception for that. And there's no way to put up a piece of plexiglass to allow for a shorter distance either.
So are they required to have masks if they're singing on stage and they're 25 feet apart, 25 feet away? No. And that's in the current order, and that's not dependent on us being in blue, correct?
Mm-hmm.
Correct.
Right.
Okay. All right. Where would you see winery sales room belonging in the categories?
Probably retail.
Retail?
I mean, if it's the actual sales room, it sounds like retail to me.
Okay.
If it's a tasting room, then it would need to follow those restaurant requirements, having food service and things like that. If they're selling as well as people are eating and drinking, it would need to follow the restaurant requirements.
Okay. There's a question if people can have access to the checklist prior to the inspection. Those have been live on that website since Tuesday. So the pre-audit checklist is live. The HVAC checklist is live on the website. In addition, as soon as you apply, you'll get emailed the same checklist, and you'll want to keep track of this checklist because you'll want to check it off. You're going to need to submit it for your pre-audit or your inspection ready. You're going to want to have it on hand. You'll get emailed that checklist so that you can say, I'm ready for inspection. I'm going to fill out that inspection ready form. So those are available. They're available on the 5-star website, which we'll put back into the chat again. Jessica, I don't know if you want to do it again, but do it to all the attendees too. And then you can have access to them. They've been up there, so you can start getting prepared and seeing if you want to apply for 5-star.
Yeah, and it's really important that not only that it is available, but that people really need to use that before they get their audit, because that will help you ensure you're successful at passing. And it's an important tool to keep using. So once you are certified, these are the things you're going to need to keep doing as a certified business. So it's a great tool to just run through your business after you're certified to verify that you're still doing all the things that you need to. There will be sort of recertification inspections that happen every 8 weeks. So again, that's an important piece that you're doing this starting day one and continuing to do it.
If they need to add new spaces, like a new deck, outdoor deck, after being certified, so they will that be a issue in the inspection? No, because that's outdoor space and we're inspecting the indoor space. Okay, electronics cleaning. Heidi, this might be a good one. Do electronics need to be cleaned regularly when they're not shared, such as keyboards or televisions, or if they're not shared electronics? Because in the checklist, it does have a space for cleaning of electronics using 70% alcohol,
Yep.
cleaning products.
Yep. So the way that we look at it is, again, if you're not using something, that needs to be made clear, right? Taped off or sign put up, not in use, because otherwise the expectation would be by the person going in to assume that you're utilizing it. And therefore it becomes a high touch surface, and therefore it needs to be cleaned appropriately.
And I don't know if that was referencing like individual offices. So again, there's one person that uses it and it's their keyboard, and do they have to then sanitize each of these spaces? So I think the intent is really those multi-use spaces. So if this was a common keyboard, like where everybody's going and using the same computer, those are the kind of spaces that are being talked about. But yeah, individual are not the focus of this.
Yeah. So if you have one register at a retail facility or something, that would need to be, again, it's all about communal and high touch.
So those payment systems, and that's why it's a 70% alcohol, because anything with bleach or anything like that will hurt your electronics. But between usage, that common usage, those television, touch screens, payment systems, those need to be cleaned between each patron. And that's what's going to be looked at by the inspectors. Okay, so the question about inspection fees. So the inspection fee is $100. Application fee is $100. You are not charged $100 for every reinspection or any of that. It's a one-time charge. Just letting everybody know that was a question. Okay, so I got the electronics question. So when one of the questions or one of the checklist items is, your procedures or your, can they have a soft copy or does it have to be an electronic copy? Heidi, when we go in and the inspection, literally it can be just the checklist, correct?
Yeah, absolutely.
So the inspectors are trained that if we go in and we ask, do you have your COVID procedures? You can have a soft copy of that checklist taped up or put up. And that's why that checklist is very important to print out and make sure you check off, because that can be your procedures that you go through. All right, I got that question. So when we're symptom screening, does everybody need to be symptom screened? Or we're looking at hotels, and Heidi, I know you've been working with the hotels in Denver on this. Sometimes it's only just one person that goes in and checks in at the front desk. How are they symptom screening everybody in some of these hotels?
Sure. What we're running into for the most part is that, they're doing what most businesses are doing that are considered essential or critical, and they're taking the temperature at the check-in desk. That's what we've run into in Denver. Some are saying that they're, collecting that information from the customer 24 hours before they come in to stay with them via email. So we're seeing a lot of different ways. And really what we're appreciating is that that it's being done, right? That it's being done, the data is being collected. Again, it's all about in service to public health, so that we could get a hold of Elaine Drager and say, here's everything you need to know about the clients we had in.
So we will, and there's a couple questions about that symptom screening form that you offered. I will send that out.
Okay.
Or put that, I have a couple requests for that.
Okay.
So if you could send that to me. Will the spacing between tables and restaurants decrease at all when we move through the levels? Lane, do you have any insight on that?
No, the spacing shouldn't decrease. If there's a future update of the public health order that decreases that is obviously something we can't project, but the current dial order and requirements has that 6 feet of spacing between patrons, again, not between tables, so that the tables themselves may need to be further than 6 feet to accomplish that. But I can't speculate of future dial and order changes that may come.
Well, and the point of 5-star is to be certified to be able to operate one level lower if we're allowed to do so, if it, if our metrics allow us, if there's no stipulations. So in some cases, 5-star may continue to still require that 6 feet to allow for us to say it's got heightened public health requirements. And that's why you're being inspected on the 6 feet. I did get a question about if they haven't gotten their confirmation email, if they submitted this morning. So I took that information down, Heidi, and I'll send it to you if that person, they should have received it almost immediately, correct?
Yeah, if you tell me, I'll check right now. I'll get it in seconds for you.
Justin.
Who?
Justin. No, I'll send it to you. We'll talk to them separately. I know it's the Rio and Boulder. So, do they need to say? So we talked about saving and logging page. You need to save and log temperatures and symptom screening for patrons at events too, correct? The answer is yes on that one.
Yes.
Okay. Someone said they submitted the application at the start of the call. They have not received an email. They checked their junk for confirmation or payment. Is this typical? Send me an email. We'll check. This is an anonymous one, so I can't tell you who. So we'll check on it. At what level? What dial level can a private party have buffet style service? Lane, will you answer the way you answered yesterday?
So a buffet needs to have someone staffing it for service. It can't be self-service.
So right now buffets are allowed as long as it's not a self-service. So someone's, serving you. Again, symptom screenings recorded in a Google form is sufficient. Are schools eligible to apply for 5-star?
Sorry.
See if
calls
Lane would take that.
So critical businesses, I don't think are meant to be part of 5-star. So again, schools have a whole set of separate guidelines similar with childcare and many other sectors. So this is, I think, is focused for those all the sectors that were called out separately within the different orders, aside from what are critical businesses and critical functions.
Okay.
Now, if a gym is being used, like say a school either provides that space for others to use, now they want to be able to qualify as 5-star requirements, that might make sense for them to think about it. But as far as to have more kids in a classroom or things like that, yeah, that's not, I think, the intent or function for a 5-star.
Okay. If on the symptom checklist contact tracing form, let's say people are just walking in to ask a question. Let's say it's a museum and they're walking in to ask a question and they're not actually entering the facility. Do they still need to be symptom checked for contact tracing and their information collected for contact tracing reasons?
If they're just walking into your building, they obviously need to have a mask on. They ask a question and leave. That's probably not the same interaction as someone coming into your facility and having a higher risk potential exposure. So, that we would leave that to your discretion. If they end up being there and asking you questions for 15 minutes, you should include their contact information and screen them.
Will cleaning supplies need to be pulled out for the inspector to view? Heidi, I believe we are look at cleaning supplies, correct?
We do. We compare it against what gets sent to us in the audit ready function. The inspection ready. Inspection ready.
Inspection ready here. And
hard to toggle between these two counties, I'll tell you.
Just for everybody's knowledge, Denver's calling it audit. We're calling it inspection. So poor Heidi. If you want to contact me with specific, very unique questions, you can send them to me. I'll put my email in the chat and then we can take care of those, because some of the more specific questions, and this was a question that came up, may be hard to do in this. Lane, can you talk the difference between critical and essential for business? What is there a difference? Is it just a terminology?
Yeah, I mean, I assume that's for vaccination schedules. So that continues to be a challenging nomenclature, definitions, who's actually included and when are they going to get scheduled. So we don't have good definitive idea of when that's going to happen for those various folks. Typically, the best guidance we can give right now is when you're looking at all your employees, like the idea of front line is people who are actually interacting with customers and folks versus people who work in offices or people who work remotely. So it will be an evaluation of each job and job duty, not to say that because your business qualifies somewhere that all of the people who work for you will be people that get vaccinated. And I'm not sure if that was the focus of the question or not, but that's typically where those definitions start to play out more. If there was a 5-star component to that, maybe they want to ask something else. But as far as for vaccinations, that's kind of the best guidance I can give right now. We continue to see shifting priorities come from the state, and they're the ones that are dictating who falls where.
For example, liquor stores have been classified as essential was the example here. That's not something that the Boulder County Public Health classified as essential. But if we're talking about vaccines, we talk about this a lot on our Thursday at 1 o'clock call. So if you want to go into some of the public health specifics, not 5-star, Thursday at 1 o'clock, we do have Lane and I, it's the Lane and I show where we go through some more of the public health questions. Can a symptom screening for events be identified by the patron through a pre-event survey, or does this have to be on-site by staff? The answer is yes, they can do a pre-event survey not too far in advance, but you probably still want to take temperature check when they walk in. but they can do the pre, you know, have you been exposed? Do you have any of these symptoms prior to showing up? A quick, Lane, if you have an unmasked singer on stage 25 feet from an audience, do they need to be 25 feet from the other unmasked singer?
Yeah, as far as I understand, yes, unless they're from the same household.
Okay. Okay. So if you have 4 people walking into a brewery, you need to do the symptom check for all 4 people and collect at least some sort of information, but you only need the contact information for one of the people from the party, correct?
Yes.
Yes. What if you have 2 employees who work in the same area that cannot remain 6 feet apart, for instance, serving behind a counter? Lane, 2.
I'm not sure if I get the full, I mean, they're just saying that there's not enough space to have 2 people back there. But
Well,
then,
no, they can't maintain 6 feet between them because they're maybe working behind a counter together at a restaurant.
so I guess I'm just thinking of maybe like a fast food. I guess it might be if it's a register or something like that, it might be a situation where you aren't able to continue to use both registers. So we might need to get more specifics about that. Again, it doesn't allow you to have more people back there and just say, well, just because it's a small space, we can't be 6 feet away, but we can still put more people back there. So outside of sort of critical manufacturing where, you know, there's a critical need and there's no way to move the machinery and you need 2 people, it doesn't necessarily give allowances for small spaces to have more people in there just because it's a small space. So we might need to talk more to that particular person to understand the nuances of what they're asking. But yeah, you just might not be able to have those 2 people in there.
Okay. And then right now, if they are a small space, whether it's a gym, I've had some yoga studios contact me, or a restaurant, and at 25% capacity, they're already spaced 6 feet apart. If they're not able to decrease that spacing between it, they're not going to be able to increase probably capacity at this time because we're not decreasing the spacing between individuals or tables, correct?
Right. Yeah. The caps on people are still based on your space having a space calculator that would allow that many people. So
Because it's 25% or 50 people, whichever's lower. And then you move up to yellow, it's 50% or 50 people, whichever's low. I mean, and then there's the large space, 7,200 square feet or higher, the space calculator for those larger. And some of that might be changing, but I think a lot of this still depends on the amount of space you have and being able to maintain distance between parties. Okay, let's say it's an office, can symptom checking and recording be done by the individual walking in if it's an unsupervised office, or does somebody have to be supervising that? As long as there's a log and there's a place for them to record it, they can do it themselves, correct?
Correct.
I mean, I guess the additional pieces to that are if you're sharing a thermometer across each individual, there's going to need to be a way to make sure that that's now a commonly used, you know, piece of equipment. So it would just, there's some other details they may need to work out of how are those people using, if there's a common laptop that they're all logging into to enter their information, if there's a common thermometer, those kind of things are then other things they would need to address.
So in our office, we have gloves that we put on if we use the common use thermometer, or we have alcohol wipes that we use to clean it off between, and then we have to submit via a Google form on our phone or whatever that information. So that's that. Do you actually have to record the individual's temperature value or just indicate it's not above 100.3? Are we getting into that specific?
No, I think it's the intent is that you've done the check and you verified that they don't have an elevated temperature.
So customers and employees, anybody walking into a facility has to be symptom checked. So whether it's a customer or an employee, part of 5-star. Right now, in most industries, employees need to be symptom checked anyways before the start of shifts. So that shouldn't even be in a lot of cases, that's not a question because that's part of the order as it is. But the signage for if you look on the checklist, the signage for entering the facility has to do with the masking, and then there's signage about symptom checking as you enter the facility, whether they're a customer or an employee. Now, the employees might enter in a different entrance, so you need to make sure you have signage at that entrance and you have an ability for them to symptom check if they haven't already done so before coming in. We did that. All right. So we already said that you just have to confirm that they have no symptoms, that they don't have a temperature. And again, the exact value, whether it's 97.6. My gym's doing a great job. Oh, you have 90, you're a 97.6, you're good. We did your symptom check. You're not above 100.3, because if they're above 100.3, they're leaving your facility at that point too. Is there any questions about, data retention and privacy issues on this? You're not collecting the actual medical information. You're just saying you did the symptom checking.
And just want to make sure, because you've said a couple of times, it's 100.4 or above.
100.4, sorry. So don't have 100.4. Well, if you have 100.3, you're pretty close too there, Lane. I'd be taking it again too. All right, I have a couple more. I'm making sure there's none that came in the chat. So Heidi, this might come from you. So apparently iPad has said that you can't put any liquids on the iPad to use a lint-free cloth only. What have you learned with that specification around the alcohol solution?
Sure. We actually have an iPad at H2, and what we've done is make sure that there's hand sanitizer located by that iPad, and we just ask people to clean up their hands before they touch the iPad. That's how we've addressed that.
You can use alcohol wipes. I mean, people use those on all sorts of electronic, often before they put on screen protectors and things like that. So that's another.
Yeah, so the 70% alcohol wipes are something, and that is true. Before you put the screen protector on, you're actually wiping the screen with that. So as opposed to spraying and putting liquid on there, you can, the inspectors are told either wipes or a solution that's 70% alcohol. Okay, so any of you that said you registered and didn't get an email back, I collected, unless I did get an email from you. Heidi has sent me the recent list of anybody that submitted their application, so I will look and get back to you. I'm uncertain on one of these. If we use the HOP for our business, will we need to submit for the HOP as well? I don't know what that is in reference. Is that to the bus?
I don't know what that is.
Don't know. So maybe send me a separate email on that one just to clarify. The application is a kind of a 3-step process. First, the application, then you're going to pay your fee, then you're going to do your inspection ready form once you're ready to be inspected. So it's really 3 steps. Do the application, you should get an email back directing you to payment and directing you to the inspection ready form when you're ready to submit that piece. Okay, got this person, they didn't get the email. I will send it out as soon as we're done with this. I will try to send it out to you. And then if you have any specific questions about performers, because that's more of the public health, please send me those questions and we'll try to get those answered. We had a lot of questions today. Thank you. I think we're going to cut it off this time because it's at 12:15. If we didn't get your question answered, remember there's there is an email address for 5-star, or you can email me and we'll try to get your questions answered. But I think we covered most of the main topics today. Thank you, Heidi. Thank you, Lane. Thanks, Jessica.
You all.
Have a good day off, Jessica. All right. Bye, everybody.